Hi friends, in this topic of ECG basics, today I will talk about long QT syndrome. First is the disclaimer. Caring Talks YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. Coming to long QT syndrome. Long QT syndrome is typically characterized by prolongation of the QT interval in the ECG and by occurrence of syncope or cardiac arrest. It is mainly precipitated by emotion or physical stress. It can lead to a potentially life-threatening arrhythmia called Torsades pointis, which results in syncope and sudden cardiac death. As we know that normal QT interval is less than 440 milliseconds, that is too large scale. When it is prolonged, and that is when it becomes more than 450 millisecond, we call it as a long QT. And this long QT produces ventricular repolarisation, which predisposes to malignant ventricular arrhythmias. Long QT syndrome can cause sudden fainting and seizures. Young people with long QT syndrome may have high risk of sudden cardiac death. A fainting spell because of long QT syndrome can happen with little or no warning. Before fainting happens, some people with long QT syndrome may have some symptoms such as blurred vision, lightheadedness, pounding heartbeats, that is palpitation, and weakness. Causes of long QT syndromes are like drugs, amiodarone, tricyclic antidepressants, some antibiotics like fluconazole, erythromycin, metoclopramide, quinidine, haloperidol, droperidol, methadone, ondansetron, and SSRIs. Genetic causes are because of some cardiac ion channel mutation in sodium potassium channels. Certain myocardial disease like MI, rheumatoid fever, third degree heart block, cardiomyopathy, they may predispose to long QT syndrome. Electrolyte balance like hypocalcemia, hypokalemia, hypomagnesemia, they also contribute to long QT syndrome. Whenever we assess the patient, we have to take proper history of syncope, exercise induced syncope, whether any family history, any history of cardiac arrest in the family. At times, examination findings may be normal. The investigation for this is just in the ECG we will get long QT syndrome, long QTC, that is more than 450 milliseconds, and echocardiography may suggest some structural heart disease. Patient is managed with beta blockers. We have to avoid the condition which predisposes to increased sympathetic tone. Cardiac pacemakers or ICD may be helpful. We have to treat the cause. Observation, reasons, human understanding, courage. All this makes a good physician. It was said by Martin H. Fisher. With this, I conclude my today's topic. Thank you. Keep learning.